According to the CDC, more than 6.5 million women have trouble getting pregnant or carrying a baby to term. Now the Mayo Clinic wants to help with their new fertility and conception guide. Dr. Jani Jensen is sharing some of the highlights. Good morning and welcome.
Good morning. Thank you.
What are some of the fertility issues that you cover in the new guide?
Well, first of all, this is something that affects a lot of couples. So we know about 15% or 1 out of 6 couples has difficulty at some point becoming pregnant. It might not even be with the first baby. It might be with a second or a third. And there's so much information available on the internet that we wanted to make a very comprehensive but accurate guide about things that people could really do to improve their chances of having a successful pregnancy and help them understand what options may be available if they need even more assistance with that process.
And what are some of your nutrition suggestions to help have a successful pregnancy?
Sure. Well, probably the most important thing that couples could do, and this applies to men as well as women, is to be a normal weight. So being overweight can make it more difficult to get pregnant or stay pregnant. And people are actually surprised to find out a lot of times that even losing a small amount of weight, 5 to 10% of your overall body weight, which is less than 10 pounds for many people, can make a huge difference on your ability to become pregnant when you want.
Wow, 5 to 10 pounds, or 5 to 10%, I should say. All right, so anything else? What about age, caffeine, stress, alcohol?
Sure. Well, good news for coffee drinkers. A moderate amount of caffeine is okay for people who are trying to get pregnant and even for people who are pregnant. Exercise is good before pregnancy and also during pregnancy. The jury's still out on stress. So stress is one of the things that we know that we can control, and we definitely recommend that people who are going through difficulties becoming pregnant actively try to manage their stress wherever possible through meditation or resiliency training or even with acupuncture. So we definitely have a lot of recommendations for lifestyle modification in the book too.
All right, doctor. Now, I know it says Mayo Clinic across the top, but give me your 30-second elevator pitch why somebody should pick up this book as opposed to another book.
Sure. Well, we actually cover a lot of comprehensive and accurate information. Everything is evidence-based, and we cover a lot of modern scenarios too. So maybe you had cancer treatment when you were a child, and now you want to become pregnant, and you're wondering about that. We really welcome having same-sex couples in our practice. So maybe you're in a unique situation like that where you want to build a family, or maybe you just want to freeze your eggs and defer reproduction, which is a great new option for many women that might be right for them, and that's another aspect that we cover too. So it's very comprehensive and also up to date with all the types of patients that we see in our practice.
Fantastic. Thank you so much for joining us, and congratulations on the book.
Thank you.